As the embryo develops and the woman's weight steadily rises, the back pain and lumbar discomfort will progressively increase and worsen. Therefore, it is advisable for pregnant women to engage in pregnancy-adapted sports from the beginning of gestation. Walking every day is a good activity that helps to combat fatigue and also improve circulation. Moreover, activities such as swimming or prenatal Pilates, both modified for pregnancy, offer numerous advantages. Regarding nutrition, women should continue with the same healthy and balanced diet as in previous weeks. On the other hand, to ensure good digestion and reduce the likelihood of gas formation, it would be important to consider the following recommendations. Avoid carbonated drinks. Avoid foods such as chickpeas, beans, or cabbage as they tend to cause gas. Chew slowly and make sure to take the necessary time to eat. Avoid having abundant meals. Try to have about 5 or 6 small meals throughout the day. Lastly, it is extremely important for the woman to maintain good hydration by drinking water frequently throughout the entire pregnancy.